As a late entrant, yet many hope that local women will take up the vaccine to curb the huge number of casualties. But the very few women and girls are receiving it. Now, today we're taking a look at the rising cases of cervical cancer amid the low HPV vaccine uptake. In studio, I'm joined by Dr. Joseph Kariuki Gushui, who runs the Wonder Peace Wellness Center and a public health expert. I'm also joined by Dr. Dulce Wanda, who is an oncologist at the Nakuru Level 5 Hospital. Thank you both for making time and joining us today.
Thank you, Fatia, for having us.
Right. Dr. Gushui, if I could just start off with you, just for the audience to understand, what are the first symptoms or early symptoms of cervical cancer?
Well, cervical cancer presents itself as a very insidious disease because from point of infection up to when symptoms or the occurrence of the cancer itself can take anywhere from 10 to 15 years or even more. Mm-hmm. So unfortunately, because of this insidious nature, most of the patients will come to seek health care when quite late. Why? Because most of the symptoms are quite non-specific. It's not like a painful disease. It's in its onset becomes like there's a discharge, sometimes bloody, rare. A bit later it becomes a bit foul smelling. There's usually maybe some pain during intercourse, and this is also coincides with a bit of discomfort in the genital areas, but not something that is so overt that would actually jolt somebody to go and seek healthcare. That's why by the time that most patients are presenting, they will find that it's quite late in the disease.
Right. Dr. Dulce, from your experience, maybe you can tell us about the early warning signs.
So majority of the times you'd find there's a discharge, maybe having pain when having sexual intercourse, intermenstrual bleeding. So you're having bleeding that is not your menses. So between the two cycles of your menses, you find you might have some spotting. Some might complain of low abdominal pain, back pain. Of note is that in the early stages of cancer, just as Dr. Ari has mentioned, cancer is not painful. So it's the discomfort, the discharge that you might feel, the perhaps discomfort when having sex. And later on, as it gets to being advanced disease, that's when you might have the feeling of bloatness, low abdominal pain, back pain, sex that's quite painful during intercourse, bleeding when having sex. And those are some of the symptoms that may come out and be noted.
Right. Dr. Gushui, just coming back to you in terms of now risk factors, like the primary risk factors associated with development of cervical cancer. Could you tell us about that?
Okay, so the primary risk factors is the presence of the HPV, the virus. And the unfortunate thing about this is that most of us, if I was to give you, I usually like from a public health aspect to help people understand the figures, Right. Sometimes they can sound quite abstract. So given, for example, the current economic times, Fatia, I'm sure, and Dr. Arime, I'm sure you might have attempted to find a group of women with like-minded women who you want to form a chama and,
Right.
put some money together and see if you can change the way things are going. Because currently, unless you're a taxman, like you're working in the KRA, things are not working too well. Your manifesting is only happening for them. The rest of us, we are working on fingers crossed and inshallah.
And inshallah.
But now you can imagine, say you find this group of 10 women who you think are like-minded, and you sit down and you start putting some money together, right? And then say 5 years down the line, I come and tell you of these 10 women who are your friends, one of them has a 50-50 chance of defaulting on payment. So you will give her your money on the round table and she'll disappear. But here, chances have it you will find very creative reasons for going to visit your 10 friends every so often to find out how are you doing, just to make sure they don't, default. Now looking at it this way, can you imagine that group of 10 women? In that group, by the time you're 50, 80% or 8 of you will have had been infected with HPV, right? And of these 8, at least 1 will get cancer.
Right.
Those are the figures we're talking about. And the worst thing about this one is that when we say it's a killer, it's surpassed all the other cancers in the country. It's the #1 killer. It's, well, the rate of when it comes to the figures of infections, it's the second most frequently met cancer in women.
Mm-hmm.
And the thing about it is that once you don't do the things that are required to prevent it, the mortality rate in our country currently is almost at 70%. So we are talking about us needing to be very aggressive and then very in its face when it comes to prevention and taking the measures to protect ourselves. So now, given that as the premise, because the premise, another part I should add on this premise is that this is one of the most forgiving cancers. Like, diseases like, if you did everything that you're supposed to do from the onset of infection with HPV, like you go for your visits, or even before you get your HPV vaccine, and then you go for your regular visits. If something is actually noted, there are usually measures that Dr. will probably get a bit more into, that can be taken, so that if we did things very well, HPV causes about 99.7% of all cervical cancers. If you can get rid of that, you can imagine you're curing just about cervical cancer period. You know?
Right.
So that is where now I think becomes the core of the question: why is the uptake of these vaccines not coming in? Why are people not going for their screenings quite as regularly as they should? And that is a multi-pronged question, and it's quite challenging to look into.
Yeah, and I'm hoping we'll get into that question a bit later, and the analogy you've given is very interesting and also looks like a very worrying trend at the same time. Maybe from your experience also, could you tell us about some of the risk factors associated with this cancer?
So part of the risk factors, as he's mentioned, is HPV, and 99.7% of HPV cervical cancers are caused by HPV. That means if you have 10 women with cervical cancer, that means 9 of them had infection, chronic infection with HPV. So other risk factors would be perhaps cigarette smoking. Another risk factor will be immunosuppression. So anyone who's HIV positive then has a higher risk because they're immunocompromised. So the human papilloma virus, you get it by having unprotected sexual intercourse, which explains why the vaccination is given to young girls when we want to target them before their first sexual debut, so that the body is already primed. Should one get exposed to the HPV, then the army, the white blood cells, are ready to fight it off. By the age of 50, then it's possible that at least 9 out of 10 women will have had HPV infection. And perhaps sometimes it's even 100%. Everybody by the age of 50 has got an HPV infection. But the difference is the immune system is able to fight off that infection. However, there are times that you have chronic infection, meaning the HPV virus remains in your body for a long time, around those cells in the cervix, in the vagina, in the anus, and even in the penis, because HPV, the high-risk strains of it have been known to even cause vaginal cancer, cervical cancer, and anal cancer, and even penile cancer. Wow. So when we talk about the strain 18 and 16, then that's the high risk that have been really responsible for cervical cancer. So what we're talking about is if you get vaccinated, then we're priming your immune system to be more charged to fight off that virus. And if we reduce as women our smoking, because that's another risk factor, making sure if you're immunocompromised, then you know you have a higher risk, and that points to the fact that you need to go for more screening. So if you're HIV positive, then the screening is a bit more aggressive because you know the immune system is low. HIV might not be the only thing that causes suppressed immunity. We have others who've had maybe transplants and are on medication to suppress the immunity. That means they're at a higher risk of having the chronic HPV infection.
Wow, well explained. But I want, before we take a break, I want us to talk slightly about the awareness that's there. Because you know, when you go to schools and they want to give the HPV, the vaccine, there's a bit of stigma around it. Can you tell us a bit about that before we come to you?
So this is something, there's actually a recent study that was done by some scientists in Kiambu County, where you would think due to its proximity and the nature of it being a metropolitan area, you'd get better results than what was found. So The good thing is that at least 80% of the women who were asked did know what cervical cancer is. Unfortunately, 60% of them had never heard of what HPV is.
Right.
60%.
It's very high.
That's quite high. And then of this 60, of the 40% who had actually heard about HPV, less than 10 had actually even bothered to find out whether there's a vaccine, whether there's screening. And if those figures don't trouble you enough now, the idea or what they did find that was scary for them is that there are so many myths about surrounding the whole cervical cancer, HPV testing, HPV vaccines that boggers the mind, to be honest. So the awareness is a problem, because they did find that from this study that the best chances of somebody going for a screen was if they knew where the screening was done. Like 4 times higher the chances of somebody actually going for a screen was just basically knowing where the screening is done. Which means that there's a lot of awareness campaigns that need to be launched. People need to at least know where they can find help. People need to actually put HPV in the front line in terms of this in schools, in churches. I mean, let's do away with that mask, as Dr. has said.
Yeah.
I mean, at the age of 15, I think the statistics have it like by the age of 15, 2 boys out of 10 have had sexual intercourse, and at least one girl out of 10. Let's not pretend that people are not having sex. Let's just,
it's the reality.
Yeah, let's just call a spade and actually do the work.
Right.
Help these people actually protect themselves. And so awareness is an issue. And the other huge issue is that even when people are aware, the few facilities that should have the amenities to give care, whether it's by vaccines or the screening, you will find, like, from the estimated 6,000 hospital healthcare facilities that we have in Kenya, about 5,700, less than 20% of our HPV screening. And of these 20%, less than 20% of them have people constantly